So hello guys, this was I think long awaited. I wanted to interact with you, and there were a lot of confusions I found there was in the case palsy in INO. So I thought we will be interacting together instead of me posting a video and then looking at it. This will be a better way of interacting and getting your doubts solved on the gaze palsy and the INO. So first of all, tell me, is my audio and video clear? Please let me know. Give me a thumbs up in the comment section if you are able to hear me. So hello guys, this was Are you able to get me? Audio and video is clear? Let me know please, so that I can continue with the conversation. So yeah, a very good afternoon to all of you. Welcome to this live interactive phase. I'll try to come live more often now, so that whatever are your confusions related to the quiz questions, related to the particular topic, we can interact here and let's the doubt be solved. Yes. So okay, it's all clear. Thank you. So if you see this image, this was the image that you got in the question, and these were your options, right? And we'll try to solve that whether it is a lesion of the middle longitudinal fasciculus, PPRF, right gaze or the left gaze. Now before we actually move on to this question per se, let me be very clear. What do you mean by gaze? So because there was a confusion about the gazes. See, suppose these are your pair of the eyes, right? And this is in the primary position. Suppose this is the right eye and this is your left eye. So when the patient is just seeing straight ahead, okay, he is not seeing in any particular direction, up gaze or down gaze or right gaze or the left gaze, then this is called as primary position or primary gaze. This is called as primary gaze. Now if I ask the patient to look in the right gaze, what is the meaning of that? Right gaze means that both the eyes are looking towards right. Okay, so when I talk about right gaze, that means this right eye will look towards right and this left eye will also look towards right. So if I make this right gaze, what will happen? Suppose this is your right eye and this is the left eye. Okay, right eye is also looking towards right and the left eye is also looking towards the right. So this means what? The right eye will go into abduction and this left eye will go into adduction. Are you able to get this? Because if this is very clear, this will become very easy for you people to understand the gaze palsy as well as INO. So when I am talking about the right gaze, I am seeing in the right gaze, that means my right eye is abducting and my left eye is adducting. Similarly, if I am talking about the left gaze, when I am talking about the left gaze, okay, now this is the right eye and this is the left eye, and I am asking the patient to look in the left gaze. So what is happening? Now my right eye will be adducting like this and my left eye will be abducting like this. So now what is happening? Now the left eye is going into abduction and my right eye is going into adduction. In other words, if you concentrate on this, when I am saying right gaze, it is actually the dextroversion. Right gaze means the dextroversion, both the eyes looking towards right, right? And when I am saying the left gaze, both the eyes looking towards left, that means I am talking about levoversion, both eyes looking towards left. Are you getting one thing now? This means that when we are doing these actions, when I am saying that a person is doing this dextroversion or he is looking at right gaze, what are the two pair of muscles he require? Version means a conjugate movement. A gaze means a conjugate movement. That means both the eyes have to move in the same direction to look in a one particular direction. So if my both the eyes are seeing in the right, that is called as right gaze, that is called as dextroversion. But in this scenario, one eye will be abducting and one eye will be adducting, and that is why what will be the yoke muscles of this right gaze? The right is seeing rightward in abduction, right? It is going into abduction. So this will be right lateral rectus and the left eye is adducting. So this will be left medial rectus. Similarly, when I am saying that the eye is going into levoversion, it is adducting of one eye and abducting of one eye. So it is the right medial rectus and left lateral rectus. So I think now this is very clear. What do you mean by gaze and what are these movements and what are the muscles, yoke muscles which are used in this, right? Now we will try to understand how these muscles are connected with each other and why do we get this yoke muscle contraction, right? Why it is actually possible that the lateral rectus of one eye and the medial rectus of the other eye are able to contract simultaneously. So this is actually related with your horizontal gaze center, that is your PPRF. Now if you concentrate here, see these are your eyeballs, okay? This is the right eye here they have shown and this is the left eye they have shown, okay? Now this means on the medial side I will have the medial rectus. So these are the medial rectus muscles and on the lateral side I have lateral rectus muscle. Now one thing is very important, that the lateral rectus of one eye is associated, it is connected with the medial rectus of the other eye. Similarly, lateral rectus of this eye will be connected to the medial rectus of this eye. So it is not the same side. Lateral rectus of one eye is connected with the medial rectus of the other eye. It is this way round. So how is it possible? So let's try to start. Suppose you are seeing the lateral rectus of this left eye, okay? So lateral rectus of the left eye, it's supplied by which nerve? The sixth nerve. So we have the abducent nerve here. This is very clear, I think. See, this is your abducent nerve coming, and it will be going where? It is going into the abducent nucleus here, right? Similarly, it is connected with the medial rectus of the other eye. So, this is your medial rectus. Medial rectus. So, if I am talking about the left gaze, if I am talking about the left gaze, the person's left eye lateral rectus and the right eye medial rectus, these both required simultaneous and equal innervation, so that the lateral rectus of the left eye and the medial rectus of the right eye both move simultaneously to produce a levo version. So, how they get the similar innervation in both the eyes. So, this is supplied by the abducent nerve. If you see this medial rectus is actually supplied by this oculomotor nerve. So, oculomotor nerve is going into the oculomotor nucleus, and this oculomotor nucleus and abducent nucleus have to be connected. So, one nucleus this, one nucleus this. So, this becomes internuclear, right? That is why the ophthalmoplegia that takes place in these connecting fibers is called as internuclear ophthalmoplegia. Are you getting this? Because on one side we have the abducent nucleus, on another side I have got the So, on one side I have got the abducent nucleus and on the other side I have the oculomotor nucleus. So, when I have the problem with the fibers which are connecting these two nucleus, then that is called as internuclear ophthalmoplegia. And what are the fibers? These fibers are medial longitudinal fasciculus. So, actually the medial longitudinal fasciculus is connecting the third nerve nucleus and the sixth nerve nucleus. Now, how we are getting innervation for the gaze? So, this innervation is actually coming from this PPRF, parapontine reticular formation. This parapontine reticular formation is sending the innervation to the sixth nerve nucleus, as well as it is sending to innervation to the third nerve nucleus, but of the opposite side. So, I can say, if I draw it in a simpler form, suppose this is your eyeball here and this is your eyeball here, right? Now, this was your right eye and this was your left eye. This was the medial rectus muscles here and these were the lateral rectus muscles like this, right? Now, I am talking about this gaze, that is left gaze. When I am talking about this left gaze, basically I am concerned with the lateral rectus of the left eye and the medial rectus of the right eye. So, I will be drawing a demarcating line here. Now, this lateral rectus is supplied by the sixth nerve nucleus. This medial rectus is supplied by the third nerve nucleus. This is very clear, right? And I told you that the connecting fibers, these are the connecting fibers here which are called as medial longitudinal fasciculus. This is also very clear. Now, we are saying that there is a horizontal gaze center called as PPRF. PPRF is the horizontal gaze center which is actually sending the innervation to this sixth nerve nucleus and to this medial longitudinal fasciculus, right? So, that means if I have a problem with the medial longitudinal fasciculus, then what are the implications? Suppose I say that there is a MLF lesion. Okay, if there is a MLF lesion, then what will happen? If there is a problem with this medial longitudinal fasciculus, it will not send the innervation to this third nerve, and therefore this medial rectus is not able to move. So this eye will show you adduction deficit. It will show you the adduction deficit on the same side. Then it will show you the adduction deficit on the same side. But now what will happen? This PPRF will send more innervation to this sixth nerve. So the other eye will show you abduction nystagmus. It will show abduction nystagmus, right? Now suppose I say that there is a problem with the PPRF plus the medial longitudinal fasciculus. So you have to consider now, if I am saying that there is a problem with the PPRF, maybe right side, then you have to consider both the things of the same side, not like this, that PPRF of this side and the medial longitudinal fasciculus of other side, because they are actually present on the other side. So these connecting fibers are the medial longitudinal fasciculus. So basically the medial longitudinal fasciculus is concerned with the third nerve of the same side, and it is concerned with the sixth nerve of the opposite side. Now suppose I am saying that there is a problem with the right eye PPRF plus the medial longitudinal fasciculus. So what is the implication of this now? That means this patient, because of the PPRF, this is your ipsilateral. So if I am having a problem with the right eye PPRF, there will be a problem with the right eye lateral rectus, ipsilateral lateral rectus. That is why there will be your abduction deficit. So right eye will show you abduction deficit, right? Then the PPRF is also innervating, this PPRF is also innervating the MLF of the other side, contralateral side. It is also innervating the PPRF of the other side. That means the other eye will also show your adduction deficit. The other eye will show the adduction deficit. Now we are saying that there is a MLF lesion. So if I am saying that there is a right eye MLF lesion because medial longitudinal fasciculus is affecting the third nerve of the same side now, so this right eye will have the adduction deficit also, right eye adduction deficit. And what will happen due to the medial longitudinal fasciculus? Plus there will be left eye abduction nystagmus. Left eye abduction nystagmus. Now look at the things which are happening here. In the right eye, I am having a abduction deficit also, adduction deficit also, and in the left eye, I am having what? I am having one single adduction deficit. Why this adduction deficit? But other eye is showing you abduction nystagmus, means one eye both the movements are lost, other eye only the adduction is lost, abduction nystagmus is present. So this is called as a 1.5 syndrome. So this is called as a 1.5 syndrome. So this is actually the basics. Now if you see the question, what they are trying to say, first they have shown you the baseline. This is your primary gaze. This is your primary gaze. They have already told you this is the right eye and this is the left eye. So this is the right gaze means. This is the right gaze. So right gaze mein right eye is showing you abduction and the left eye is showing you adduction, and both are normal. So right eye mein, when the patient is trying to see towards the right eye lateral rectus is working fine and the left eye medial rectus is also working fine. So that means no right gaze palsy. That means the person does not have any right gaze palsy because he is able to see the right side. Now see the other condition. When the arrow is this side towards the left eye, that means this is your left gaze. when the person is trying to see towards the left side. So now the left eye lateral rectus and the right eye medial rectus have to contract. Clear hai? Now left eye lateral rectus is contracting, but it is showing you nystagmus. But the right eye medial rectus is not contracting. See, it is in the midline only. So that means the right eye में medial rectus deficit with contralateral abduction nystagmus. So this means that there is a right eye medial longitudinal fasciculus lesion. There is a right eye medial longitudinal fasciculus lesion due to which the person is not able to adduct and he is showing the left gaze palsy. And that is why he is showing the left gaze palsy. Have you understood now? Please post your doubts. What are your doubts? How to find the yoke muscles, ma'am? How to find the yoke muscles? I think I have told you this. See, this is a very easy way of finding the yoke muscles. See, suppose this is your eyeball. What are your 6 cardinal positions? It is the dextroversion, dextro elevation, dextro depression. Similarly, we have to go like this. This is your levo version, then levo elevation and levo depression. These are the 6 cardinal positions. So it's very easy now. What you do, start dextro hai, so you have to start with the right. So right, 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 and for the levo, left, left and left. Okay. So now because it is on the upper side, so elevation hoga. So right superior rectus. Dextroversion hai towards the right side. So right side mein when you are seeing right eye towards the right, so it is the lateral rectus, and inferior mein inferior rectus. Similarly superior rectus, lateral rectus and the inferior rectus. Now what you have to do, just flip the muscle. This is the easiest way of getting your yoke muscles. Flip kaise karna hai? For right take left, for superior take inferior, and for rectus take oblique. See, this is its yoke muscle. Very easy. In moments you will get it. Right, left superior rectus ka yoke muscle, right inferior oblique. Right. फिर left inferior rectus का right superior oblique and right inferior rectus ka left superior oblique. Suppose I want to find the yoke muscle of right lateral rectus. So right lateral rectus ka left medial rectus and left lateral rectus ka right medial rectus. This is the simplest way of getting yoke muscles. Rationalization hai. Suppose I want to see towards right. अभी मैंने क्या बताया? When you want to see towards right, right का कौन सा muscle use होगा? Lateral rectus. And which muscle of the left eye? Medial rectus. Means right lateral rectus and the left medial rectus will contract simultaneously to see towards right. इसी तरह से the left lateral rectus and the right medial rectus will contract simultaneously to see towards left. So these are your yoke muscles. Have you got this? How to get the yoke muscles? Yes. So now let us see the options of this question. They were showing the palsy. I told you this was your left gaze palsy, है ना? Why? Right medial longitudinal fasciculus lesion will give me a problem in the adduction of the same side. और ये adduction कब होगा right का? When I want to see towards left. So that means it is a left gaze palsy. While the question was already showing that there was no problem with the right gaze. The person was seeing normally with the right gaze. So you can easily rule out it is not the right gaze. ठीक है? Then you see they are saying, is it a left medial longitudinal fasciculus lesion? Now let us see here. Left, if it would have been a left medial longitudinal fasciculus lesion, then there should be a adduction deficit in this eye. But here I am showing the there is a abduction nystagmus. So when I have a INO and I have a medial longitudinal fasciculus lesion, I have the adduction deficit on the same side and the abduction nystagmus in the other eye. That means there is no medial longitudinal fasciculus lesion in the left eye. where you have the MLF lesion in the right eye, जिस side का MLF affect होगा, on that side I have a adduction deficit, दूसरी side का I will have the abduction nystagmus. So that means I am having the right eye MLF lesion, but there is no PPRF lesion. Why I am so sure that this is not PPRF? क्योंकि if there is a combined one, then I would be getting what? 1.5 syndrome. Then I'll get 1.5 syndrome, और 1.5 syndrome में क्या होगा? Even this lateral rectus abduction is also lost. Same side के both the movements are lost. Other side का only abduction nystagmus is there. तो ये भी absent होना चाहिए था. But this is present. Patient is able to see in the right gaze. Therefore, I will say that there is not a PPRF lesion. इसीलिए ये option भी गलत है. Because most of the students gave me the answer right MLF was PPRF. It is partially correct. Right MLF lesion है, but not the PPRF lesion. Are you getting this? तो gaze क्या होती है? Yoke muscles क्या होते हैं? How to find the yoke muscles? What is the internuclear ophthalmoplegia? What is 1.5 syndrome? And how to differentiate? If it is a right MLF lesion, you get a left gaze palsy. If it is a left MLF lesion, you get a right gaze palsy. So try to differentiate between the MLF lesion and the gaze palsy. दोनों में difference है. Right MLF अगर जाएगा तो you are not able to adduct the right eye. और right eye हम कब adduct करेंगे? Left की तरफ देखने में. इसी तरह से left eye अगर MLF lesion है तो left eye में adduction problem होगी. And when you would like to adduct this left eye, when I want to see towards right, तो gaze palsy is always opposite. So don't get confused. Right MLF से right gaze palsy नहीं होगी. Right MLF से left gaze palsy होगी. 1.5 syndrome होगा if there is a PPRF and MLF lesion both. Is that very clear to you? Please ask your doubts if there are any. So I think this was a short, crisp but effective session. And do comment to me, tell me if you like this session. We can have more of such sessions so that anything that is wandering you, troubling you so much, we can discuss and be interactive. Tell me if there is